I'm Nancy Crum-Cianflone. I'm one of the infectious disease staff here at Navy Medical Center. I am going to give you a little bit of my perspective in writing a scientific paper and doing research. And please feel free to ask any questions or interject any comments you might have as we go through this. I am an ID staff here. I've been at the command for 13 years. I've been in the ID department for 10 years. I did my internal medicine training and chief residency here. Then I became an ID staff. And about 2 years ago, I decided to get out of the military, but continue to work here as a civilian. And so much of what I do is take care of ID patients, but I also do quite a bit of research as well. And so just kind of want to go through publications and research projects. And I'd like this quote from Ernest Hemingway, which says, "We are all apprentices of a craft where no one ever becomes a master." And I think if Ernest Hemingway can say that, we all strive to be better writers and better researchers. And it's a lifelong of gaining more experience and being more of an expert in this field, but we can all continue to learn. These are the objectives for this talk today. First and foremost, to think about publishing, no matter what your level of training is. Medical students, residents, fellow staff, all should be encouraged to think about publishing. We're going to talk about the various study research designs. We're going to talk about how to write a scientific manuscript, and then talk a little bit about the potential joys as well as the potential pitfalls in trying to do research and publish. So why would you want to publish something? Well, here is just maybe some reasons. I'm sure there are others, but one is to enhance your CV, job applications, maybe after you got out of the military. I can tell you my CV is what led me to get the job to come back as a civilian and do research here, is because I did a lot of research when I was a resident and a fellow. And it may also help with GME selection. It's one of the things they do look at, is what's on your resume in terms of publications and research. Obviously, we're all here to make a contribution to science and medical care, and much of the research we do helps us advance the field of medicine, and so that's another reason to publish and do research. Some people find it gratifying to get their name in print. Also, to gain a reputation in the scientific community. People see your name in print, people will call you for advice, people will call you to collaborate with you on projects. It's a way to sort of get to know other people outside of the command who work in your area, in your field. When should you begin publishing? I would suggest now. There's never a time that's too early. Any stage of training, you can start to get published. And although I often thought when I was a trainee here that I was really busy and I never had time to publish, I can unfortunately assure you that that doesn't get easier. Being a staff doesn't make you have a lot more time than before. And so we all have a lot of obligations. It's really difficult to fit this into our time schedule, but consider spending some additional time doing research or publishing. A lot of unusual cases here at Navy Medical Center. I think it makes it to be a great place to think about doing research, because we have interesting things going on and we have people we can collaborate with from different specialties. And so what I enjoy doing is not just working with the ID people, but to actually go to other departments and see if other people want to collaborate on research projects and getting them involved. One, you get their expertise. I'm not an expert in radiology, so we get expertise in radiology, and it's a lot of fun to collaborate with people and join together to do things. So that all exists here because we have all these specialties, and I think we have some really interesting patients. We also have a lot of patients here who are interested in research, and that makes it easier too. How would you get started? Let's say if you hadn't really published too much in the field, what would you do? Well, the first thing that I did when I started publishing was simply write up a case report. The other thing you could do is review the literature on a topic, or you could ask to get involved with a study that's already going on as an investigator. Then you don't have to be the primary investigator and have all those responsibilities, but at least you can get your feet wet in research. So can I take a poll of how many people published in the literature? Publications? A few people. How about involved with a research study? Research study. Okay, so good. So feel free to give your input and some of your thoughts too as I go through the slides as well. So how do you get started? Well, first choose a topic. It may be based on an interesting case. As you'll see from some of the things I'm going to show you during this talk, a lot of things begin with an interesting case or something that just doesn't seem right or something that you look up in the literature and there's just not a very much information about this. Boy, I wished I knew more about this. And then it goes forward in terms of either a research project you may do or a review that you might write for the literature. You should decide on an audience who would be interested in your paper and its contents. You can use well-published people in the field to help you, inside or outside your department, and then decide on what kind of article you might want to write. So I like to give this example. This was when I was a resident and I was working with Preston Gable, who's a hematologist oncologist, and we wrote this article because we saw an interesting patient who came in and got admitted because she developed HUS, and it was sort of determined then that this was probably due to her use of quinine for leg cramps. So we thought this was kind of an interesting case. There wasn't really too much in the literature about this, so we decided to write up this report. And so we went forward with this, and we wrote up a 20-page paper about quinine and HUS. So you can imagine, okay, you guys are laughing a little bit. So what was the problem with that? Well, first I was a resident, really didn't know what to expect in terms of publishing something. And of course the journal came back and said, no, they weren't interested. This was way too long and laborious. We want something much shorter. And so from this I really learned that one of the best ways to get into publishing things is being very familiar with the journals you might want to publish in. We all read them because we're in that field. But I started to read the journal not just for the scientific information that I needed to know to be a good doctor, but also to read them in the thought process of, what if I wanted to publish this? What is the size of the article? How is it written? How is it laid out? I needed to get a lot more familiar with that because I obviously wasn't very familiar here, and our 20-page paper was not something an editor who's very concerned about the space content in his journal was really interested in. We then went ahead and we reduced the paper to about 4 pages, and we resubmitted it, and as you can see, it did get published. But it was a really long, winding path road to get this published, which a lot more work than was required, because we wrote 20 pages, then we had to trim it down to 4, and so we spent a lot of time and effort that wasn't really necessary. And had we known, or I had known a little bit more about what the journal was looking for, then I would have written a 4-page paper in the beginning. So this to me emphasizes determining what article you want to write, what type of article, what is your audience, and what journal would you submit it to, or kind of a range, will help you, I think, decide on, okay, how should my journal article look that I want to submit to this journal in terms of the length, in terms of the sections, the references, and so forth. So what kind of articles could you decide on? Well, I think the simplest is simply to write a case report. That's how I think a lot of us get started in publishing. You can do a case series, a systematic review of the literature, a meta-analysis, or you can go ahead and actually do a study. So I'm going to go through these a little bit. I know you're familiar with these ideas, but I'm hoping in doing that it may make you think, hey, I've got this interesting case or this interesting idea. Maybe I should start trying to put this together to publish. So a case report is simply a summary of an interesting case. It's generally pretty easy to write. One of the most important things I think about a case report is doing a really good literature search, particularly if you're saying this is the 3rd case ever described of this condition or the 1st case. It's really good to know what's out there. Make sure you actually have the 1st case. The librarian can actually help find things that I can never find. So using Kathy Parker, for instance, to help us do another lit search after your original lit search just to make sure you haven't missed anything. And then to compare your case with what's already been presented in the literature and how it's different, how maybe it's the same, how it's unique, and how it can contribute to the scientific literature. And relatively, these are easy to publish. A lot of journals have these case reports in. And they not only have sometimes case reports, but sometimes they have photo quizzes or pictures. Radiological journals sometimes have an interesting radiologic picture. Derm journals have interesting skin pictures. Our ID journals have interesting pictures that we can present. And these are generally relatively easy to get published if you have a unique picture or a unique case, to go ahead and get that sent off and published. And so this was one of my first photo quizzes, which is a young recruit that came in with a pneumomediastinum from MCRD. And so it was kind of a neat chest x-ray. It's hard to appreciate on here, but there's air tracking all the way up his neck. And it was accepted into, just a general medical journal as an interesting case. So a little bit beyond a case report would be to do a case series where you have 2 or 3 or so cases that represent the same sort of disease that you might want to publish together. Writing is very similar to a case report. Again, a rigorous literature search is really necessary. And, the other thing I would suggest is we are not prohibited from combining cases with other institutions. And so one idea is, for the infectious disease group at least, we present cases at the university. And one thing that sometimes we do is to say, we saw this really interesting case. Have you ever seen anything like this? And occasionally they'll say yes. And occasionally we can combine our cases and actually make a case series of these unusual diseases or presentations. And obviously it's a little more valuable to the literature if you can present more than one case. And so talking to people in the facility, talking to people maybe outside who might have seen similar things, and working with them to publish together. You can also do a review of the literature on an interesting topic. Sometimes I get asked, well, I really don't see very many interesting cases, so what would I do? And I think here at Balboa that usually is not a problem. We see a lot of interesting cases, but there might be situations where you're kind of just seeing the same old thing and it doesn't seem too interesting to publish, but you're interested in publishing. And one idea is to actually do a review of the literature on a timely topic. And only you know what a timely topic would be for your particular area. But you could consider, one idea is to think of an area that needs to be reviewed or would be really interesting to review for your area. And often it's helpful to try to pair up with some sort of expert in the field. One, they can help guide your writing of the article. In addition, although journals sometimes deny that a familiar name makes it easier to publish, I think there is something to the fact that if you have an expert in that field writing an article with you, it probably is, in fact, easier to get published. And so trying to pair up with someone who has written in this area or is well known in the area is very helpful. And again, I think it's an easy to publish format if it's a timely piece that really answers a question that's important in your field. And this was not a timely piece or interesting piece, but a journal was interested in someone reviewing this particular infection for them. So I got asked to write this article, which was just a review on a particular bacteria that went through all the clinical manifestations and what you would treat it with and so forth. And so some of these opportunities come up for journals because they're looking for people to review certain areas, and there'll be an invitation to do that. Another thing that we can write that's not really research is a meta-analysis, a paper really using statistical methods to answer a question. One of the things that is imperative to this is that you really have to do a great literature search to get all the studies you'd need to combine to do your meta-analysis, and that you would need a statistician to probably help you unless you knew the statistics to do a meta-analysis. You'd have to really watch for biases, publication bias, particularly because a lot of times negative studies aren't published, and that could sway what you're relaying in your meta-analysis. And so this is an idea, again, of an area like a review where you may not have a study yourself, but you see a need that there's several small studies that sort of trying to answer the question, but there's still a question about what should we do in this area, that maybe by combining these studies you could give the readers a more clear answer by combining all the studies. Of course, one of the things also that has to be done, which I didn't mention, is that you really have to get the data from all these other studies. So you would have to call the authors of these other studies, have them give you their data so that you could use their data to analyze it all together as one. The things that I just talked about, the case reports, The meta-analyses, doing a review of the literature, is something we can do that's not really considered a research study that requires IRB approval. You know, that's just something we can write up. It's not really considered research. I would encourage you to submit it through the CID department because they can help you get the submission done and make sure there's nothing else that's needed. And that is nice because you don't have to have a protocol. But now we're going to move into an area where actually you're performing what we would consider research and you would need a protocol. And these can be forward or backward protocols. They can be observation or experimental protocols. But all of those need CID approval. Even something just like a cross-sectional study where you're just going and reviewing charts in your clinic is considered research and would need CID approval through the IRB. We do a lot of cross-sectional studies. Cross-sectional studies are really great in terms of that you can do a chart review. They're relatively easy to do. They're not very costly to do. And they do provide some good information about associations between things that you might be looking for. Certainly they can't answer questions about incidence or causation, but they can provide some good prevalence data and risk factor data. So for instance, I work in an HIV clinic, and we've been seeing a lot of people with liver and kidney dysfunction in our clinic. And the question is why is our patient suffering from kidney and liver disease? And so one thing is that we've done is just pull their charts, write down what their kidney function is, write down their medications, write down the other comorbidities they may have that affects their kidney function, look at what the prevalence of kidney dysfunction is in our group is, and then look for risk factors. Is there some commonality that they're all on the same drug that might be causing their kidney dysfunction? And of course that actually turned out to be the case, that one of the most common reasons that our patients are developing kidney disease is by taking one of these antiretroviral medications. And so it does provide some information that's interesting. Of course, it's not as robust as a prospective study. So that was an example of a cross-sectional study and a case control study. To go ahead to do, cross-sectional is one point in time. A case control is more of a retrospective look with the chart review like I was just talking about. Or you could do a cohort study where you follow people forward in time, looking for exposures and then disease outcome. Obviously this takes a bit more time. It's more powerful because you can actually calculate incidence of disease and you can actually look more closely for causation. But of course it does take more time and money to follow people forward in time. Just to talk, I guess, another thing about a cross-sectional study, we're doing a cross-sectional study right now in our HIV patients, looking at the prevalence of heart disease in HIV patients, which is also a big thing that's discussed in our literature a lot, where at one point in time we're imaging them and we're recording their medications and seeing if there's a correlation between what is going on with their medications and the prevalence of how much plaque they have in their vessels. And obviously that's a collaboration with some of the guys in your department, including Dr. Asher. So then you can do experimental studies, not observational. So everything I just described, which was doing a cross-sectional study, doing a case control study, doing a cohort study, those are all observational studies where you're just following patients. You're not really doing any interventions with them. So again, cross-sectional at a single point in time. The case control study is a retrospective chart review study. And the cohort study is a prospective study where you follow people over time. We actually have, to give you an example of a cohort prospective study, we have a HIV study going on in our clinic. It's been actually going on since 1986, where we follow anybody who's willing to enroll who's positive for HIV over time to sort of see what diseases and problems that they develop. Again, we're not offering any interventions to this group. It's simply to just record everything that's going on with the patients so we can understand more about the natural history of HIV in military personnel. Experimental studies, of course, are those where you're going to offer some sort of intervention, often that this is a drug treatment trial. Obviously, this requires a lot more time and money and is more difficult to actually execute. But the publication is usually relatively easy, particularly if you're studying something that one is interested in. Recently, we just concluded an experimental study with the NIH where we were actually using Lipitor to try to control HIV-positive patients' viral loads for HIV. And so that's an example where part of our patients were getting placebo, part of our patients were getting Lipitor, and we were comparing their viral decays between those two groups. So again, a randomized, blinded, experimental study to look at an idea of whether Lipitor can control viral replication. So where do these ideas come from, and how does one get an idea of, I want to do this particular study? Well, a case report's pretty easy. A case comes in, it's very unusual. You search the literature, there's very little written about it. You might have the first or the second case of some condition, then you publish it. For some of these other study ideas in terms of the chart reviews, the observational studies, or even the experimental studies, where does one come up with ideas? And these are my top three ways I find ideas. One is from my patients. As we clinically take care of patients, we have a lot of patients who like to read up on things and think about things, and they're very interested in their health. So a lot of times they come in with these ideas about, why is this going on with me? I've read about this. And if our patients are interested in it, then also they may be willing to participate in a study, and that might make it more successful. Reading journals and going to scientific meetings is another place where you can see where there's holes in the literature where you might be interested in trying to fill some of those gaps. And also from failed studies. We don't like to think we have failed studies, but occasionally we have a study that just doesn't work out. We actually had a study that was closed last year because of poor enrollment, and we couldn't get people into the study because we couldn't find patients who met the inclusion criteria. And the inclusion criteria were that the patients were not on antiretroviral therapy yet. And so we were looking for a small cohort of our patients who had not yet started drug, and we couldn't find anybody anymore. When we wrote the study, there was a lot of patients who fit that criteria, but when we went to execute the study, there was very few patients. So we ended up having to close the study because of lack of participation in it. And that came up with this paper, which just is getting published in May in one of our ID papers, which is the question, is HIV becoming more virulent, and people are presenting with lower CD4 counts and therefore having to start meds earlier. And so although we had one failed study that we couldn't execute, it led to another question that resulted in another research project that we just finished this last fall. So those are some of the ideas of where to come up with things that you might want to look at. So of course, after you get done with your research project, whether it's a chart review, whether it's experimental study, obviously the next big push is to actually get it in print and write a paper. And so I would encourage any of you guys who have data or have cases that you just kind of set aside and haven't quite published to think about getting those back out and actually publishing them. Sometimes it's difficult to do that with all the time constraints, but I think it's very important to get the information out. So these are the contents of a typical scientific paper. Every journal's different in what they want. Again, be familiar with your particular journal you want to submit to. I'd recommend formatting the paper based on these standards of the journal from the beginning. That will save you some time. Remember that it will require many revisions before you're ready to submit. None of us sit down and write a paper in an evening and submit it. We generally write papers over several weeks and do many, many revisions until we're happy with how things are stated. And we have to be cognizant about the space. And one of the things that takes a long time to do is to get it to the word limit that the journal will accept. And then we have great staff in CID who will help you try to get your manuscript moved forward. And this is one of the other reasons I would encourage you to think about publishing and doing research while you're here at Balboa, is because a lot of commands don't have the staff to help us. And these are just some of the things that they'll help us do, including checking our grammar and communicating with the journal. I know I used them a lot when I was deployed, when I was in the military, because I would be gone for many months on deployment and I never knew what was happening with my papers. I would ask CID to track the papers and make sure things were moving along, and they did a fantastic job doing that while I was away. So that's another reason to have them help you. The abstract, it's the first thing after the title that we really all look at. I don't know about you, but I'm very busy, so a lot of times instead of reading the entire article, I'll just read the abstract. It really summarizes the contents of the paper, should attract the attention of the audience, and I usually write this section at the very end, right before I'm ready to submit it. I don't write it first. I have to think about how the whole paper should be viewed, and then condense it, and then write that section last. Although it's the first thing we read, it should probably be the last thing that we actually write. The introduction to the paper provides a background of the subject that you want to talk about. It should provide a teaser for your reader, like why would you be doing this study? Kind of presents what's out there, what holes there are in the literature, and what your study serves to answer, or what your paper is going to answer. The method section is how the nuts and bolts of how your study was done. I usually write this section first, and largely this can be cut out of your protocol if you've done a study and put into your paper, at least as a starter, because you've already written the methodology for your study in the protocol you've had to submit. You should make sure all the necessary details and how you've done the study is recorded in the methods, so that someone else could probably duplicate your study if they wanted to by simply reading your methods. And I wouldn't assume that the audience knows military terminology. Sometimes we're used to using certain terms that might not be common in the scientific community, and be cognizant of that and sort of explain those as necessary. The results section you should be able to write right after you finish your study and you have your data analyzed. You'll present the data in text, but also in tables. You can use graphs. I find graphs of pictures really helpful. It really attracts the reader's attention to your article. And you simply, in the results section, state what your results were. You don't interpret them. You don't explain them. You don't tell them what they mean. You basically just state your results. Really, the discussion is for you then to explain why you might have found X or Y. It's important to compare your findings with other studies in the literature, and this ties it back to your introduction. As you write your introduction about this is what's already in the literature, this is what my study is going to answer, in the discussion you can kind of go back to that and say, here is the literature again, this is what they found, this is what we found, this is why our study was different, and so forth. Describe the significance of your findings to your readers. What does this mean clinically, if there is a clinical meaning to it? What recommendations you might be able to draw from your conclusions of your results. And I think two things about that: never overstate your findings. If there isn't anything clinically you can recommend, then that's fine. And I think it's also important, generally it's in the second paragraph to the very end of the paper, you write the limitations of your paper. And, you know, we all know there's strengths of every study, but we all know that there's limitations for every study as well. This is something that I had a really hard time doing when I started writing, because I thought I was giving the reviewers reasons for rejecting the paper. But in truth, a good reviewer can see what your limitations of your paper really are. And if you state them out front, and sometimes provide the reasoning behind why the limitation happened or why the limitation might not be so severe, it gives you an opportunity to put that information out to your reviewer and the reader of your paper. So I would recommend including limitations as part of the end of the discussion. You can also include a paragraph on the strengths of your study if you think that that would be useful as well. And generally the last paragraph and sometimes the last section of a paper are your conclusions, the take-home messages of your report. It should agree with the data in your results. I review a lot of papers, and I see a lot of papers concluding things that have nothing to do with the data in their results. It's probably not a way to get a paper accepted. So you have to really stick with what you've actually accomplished in your study. You can also suggest what follow-up studies may be needed, and often that's part of the take-home message is another study needs to be performed or more information in this area is needed. The final section is the reference section. Really, you should just cite what references you feel like are necessary for your reader to see. Some journals have a limit to the number of references that you write, so be cognizant of that. If you think you know what journal you want to submit to or what journals you may go to, just take a quick look on their websites and see what their requirements are. It's better to realize that there's only 20 references, that's the maximum, Otherwise, you might write 50 references, have everything referenced out, and then at the end you realize, I have to cut all these references and have to go back. So it's always a good thing to check with the journal and make sure. The other thing I would say is that if you're not sure how to reference things, check with the librarian. They're fantastic about helping provide exactly the reference style that you need. Also, sometimes there's confusion about citing websites. They can also help with understanding what really needs to be cited off of a website as well. One of the things I just briefly mentioned that I wanted to highlight on is, several years ago when you wanted to publish something, how do you know what the journal standards really are? And usually those are being published within certain editions of the journal. But right now, almost every journal, and in fact I can't think of any journal that doesn't have a website now. So that if you Google the name of the journal you want to submit to, and there's usually a tab that's called Instructions to Authors. If you click under that, that'll give you all the information about what types of articles they'll accept, the length of those articles, the number of references that are allowed, and the style of the references. And so it's really quick to click on there, see, is this idea going to fit in this journal? What should I do in terms of references? And it's great to know that right up front. Authorship, I'd say be responsible. I think the quick and easy way to remember this is that we can't publish data twice. You can, though, publish data at a scientific meeting, like as a poster, and then submit the exact same thing to a journal. That's okay. But if you try to publish the exact same article or the contents of the article in two different journals, you'll get in trouble for that. If the journal finds out, they'll come back to you. And I've even seen people write to the journals and say, we've noticed that this author submitted the same material to both of your journals. And the journal editors are quite upset about things like that happen, because they want to publish original research that's never been published elsewhere. So be responsible, only submit your work to one journal. If there's certainly a possibility that you do a big project and there's various components of it. So you might be able to publish 3 papers out of one study, but just make sure that you're publishing different data or different aspects of the data, that you're not just publishing the same information over. And what would happen if someone would catch you submitting the same information twice? They don't have like the journal police that come and get you, I don't think. But what it does do is that journal probably wouldn't accept things from you in the future. So it's probably best to keep in good with the journals if you want to keep submitting things. Authorship give appropriate credit to the people who were involved in the study. There's always this question of being an author versus being in the acknowledgments. Certainly the author should be involved with actually conducting the study and helping write the paper. Many journals now have guidelines of all the criteria you need to meet to be listed on the author line. And a lot of the signature forms now have you check exactly what you did to be an author on this paper. What they're trying to do is to suggest to people not just to include your friends on your papers or include each other, like you include me, I'll include you, and we'll both get double the amount of publications, but that you actually contributed to that work. And JAMA actually has published guidelines on what it means to be an author, and so if there's questions you can refer to that. Typical number of authors is 3 to 6 on a paper, but it varies. It could be 1, it could be an entire group of people. One thing you have to be cognizant of is journals do have limitations of how many authors there can be. Sometimes it's 12, sometimes it's 10. So you have to sort of watch that a little bit because they do limit that number. The first author is generally responsible for the article contents. It's generally the PI of the study, the principal investigator. They're responsible for all the journal communications. The second best place to be located on a paper is actually at last, a spot, and that's generally the senior author who provided expertise and guidance as the project went along. Was not necessarily the PI of the project, but sort of the mentor of the project. The tips I want to offer include thinking about the length of the manuscript. I like this quote from Pascal. Sometimes it's much easier to write longer things than shorter things, but journals want short and concise. And that's part of the reasons it takes a lot of revisions. And probably the reason that the first paper I wrote was 20 pages, it was somewhat easier just to kind of go on and on, advice to try to shorten it up and be concise. But to be successful, making it short and concise is what they want. Other tips, photos. You can certainly include photos or images within your manuscript as you think would be helpful for publication. We do have a photography staff here. This slide is sort of outdated because most of us have digital cameras now. So we don't necessarily have to call MedPhoto for pictures that we want to include. We just zip out our digital cameras. Just remember that the command does have rules about that, and make sure you follow those, and make sure that your patient consents to having their photograph taken. And particularly if you're going to publish the photo and it may have any identifying characteristics, you really need to get their consent for that before you publish. And ideally, you should not include any identifying features of your patient when you publish something. And usually we can be successful at that. The other thing I'll mention about photos is that the journals now, because of the economical times, has started to charge people for photo reproduction in their journal. So check on the journal website to make sure that they don't charge you, because you might have a successful acceptance in their journal, but then they may send you a bill saying, in order to publish this paper, you will owe us this amount of money. And that's particularly true with color photographs. Less so with black and white, but some journals are charging for both. The other thing I find very interesting is that journals now are starting to charge for all publications, some journals. And this has sort of been surprising because they've changed sometimes their requirements. It used to be if you got an acceptance letter, it was free, they would just publish for you. But now there's more and more journals that actually charge you per page for anything that they publish. So something to think about, and again, look at the websites if that's a concern, because then you'd have to find the money to get it published. Other tips, there's sometimes military issues that come up. We work in a military facility. We need to be cognizant of this. I think this is the reason that it's always good to submit your papers through the CID staff. Wayne McAllister is the person that I usually work with down there. She'll look at the article. She'll help decide whether or not there's additional approval that's needed, whether the public affairs officer should read and review the article. Often she'll send it to the PAO for approval. There might be other approval that's necessary. If you did a study with MCRD, then you would need to get the MCRD folks to approve your study being done. And then, of course, publicity issues might arise, that someone finds your article really interesting and the media might show up. And we do have the PAO to help us with that as well. This is a paper that we wrote that we really didn't think was too exciting. It was a bunch of valley fever in some of our seals. But for some reason, the media got a hold of this article and was really excited about it and was calling the command along for weeks to get interviews and discuss this. And so this is a reason to make sure that CID is aware of what you're submitting, and if necessary, the PAO is aware of what you're submitting, because then they can anticipate dealing with questions that might come in. Occasionally, manuscripts go to BUMED for review and approval. Again, that sort of depends on what you're writing about in terms of the military relevance and other sensitive topics that might come up. There are some frustrations with writings that might come up. Writer's block, your article might be rejected, and it does take a while to get published. I'm just going to talk about each of these very quickly. I think we all have writer's block sometimes. We have an idea, we can't get it moved forward, we've got a paper half written, we just don't have it all the way written. Here's some ideas. Talk to somebody who's an expert in that field on writing. Talk to your senior author. If you don't have a senior author, maybe get a senior author to take a look at your paper and make that person your senior author. Also consider putting the paper aside for a few weeks and coming back to it. One thing I'd have to caution is make sure you come back to it. It's easy to put it in the drawer and never get it out. Rejections, they're what exists in the world. I mean, a journal gets way more submissions than they can possibly publish. And so there are going to be times when a good article is rejected. I would suggest that if you think you have a good article, then keep trying. A lot of times it takes 2, 3, maybe even sometimes more resubmissions to get your journal out there. So don't be deterred, even though most prolific, successful writers are rejected. Try to get reviewers' comments. Check with the journal that gave you the rejection letter if the article was reviewed, and if it was reviewed, get those comments and consider revising your paper. I think that'll increase your success if you do that. Where to resubmit the journal article? Check with people on your paper, check with your senior author. Sometimes I even search journals in the library to get ideas of other journals I might not be that familiar with that might be interested in the article. So the length of time to publication when you come back and get an acceptance does take some time. You generally, if your paper goes to the journal and the editor does not want your paper, probably within a week or so you'll get the notification. That's not good. But then you can move on to the next journal. If it goes out for review, it takes about 2 to 3 months to get the review back in general. And that review may say reject, revise, or accept. And then you go forward. If it's accept, then you're on the track to getting it published. If it says revise, then you have to consider addressing all the areas that the reviewers thought needed to be modified. And then, of course, if it's reject, you can take again those reviewers' comments, consider revising your paper, and resubmitting it again. The actual time to publication through all that is generally 9 to 12 months. It does take some time. So be patient. That's the normal trends. If you have something really hot, published, most journals now have electronic publications before it comes to print. They'll release it early electronically if it's really something that they think that should be out there very soon. So there can be quicker mechanisms, but in general, it does take a while. So in conclusion, I want to encourage everyone to consider about publishing. Something interesting that you've seen, something you have in your desk drawer. Consider getting involved with a research project that you yourself will do or that someone else is already working on. Utilize senior members, prolific writers at your department or at the command, and utilize the interesting patients that we really have here to join your research studies or to use them as case reports. And certainly utilize CID to help facilitate your research. We are very, very lucky to have them here.